Hello and welcome to my webpage and to my channel Schema Therapy with Susan. In my introductory video, I will give you a brief overview of schema therapy, one of the latest advances in psychotherapy. It has emerged as a new direction in cognitive behavior therapy, combining ideas from effective psychotherapy approaches such as Gestalt and object relation theory. This new form of psychotherapy was introduced by Jeffrey Young in 1990, and it is recommended for a wide range of mental health problems and even for healthy people with self-development needs. Schema therapy's basic idea is that when the normal healthy developmental needs of childhood are not met, early maladaptive schemas will develop. These are psychological constructs that include maladaptive beliefs about ourselves, the world, and other people. For example, if you often felt rejected and humiliated as a child, it is very likely that you will easily feel rejected or humiliated as an adult too, even if nobody means to make you suffer this way. Or, if you were a victim of abuse or bullying in your childhood, you will be much more sensitive, even oversensitive to aggression in your adulthood as well. Such feelings typically lead to many problems. For instance, as a result of early maladaptive schemas, we might not make contact with others easily and thus not be able to establish healthy and close relationships. Or we might react aggressively to prevent further humiliation, even if this action is not at all appropriate. The schema therapy definition of early maladaptive schemas includes memories, bodily sensations, emotions, and cognitions that are thought to originate in childhood and adolescence and are elaborated through a person's lifetime. They are thought to result from the interactions of unmet core childhood needs, inborn temperament, and early environment. Maladaptive schemas can filter incoming experiences and distort their meaning. This way, they will become self-perpetuating life traps, leading to situations that even confirm and reinforce these self-defeating patterns. While schemas often have an adaptive role in childhood, for example, they may contribute to survival in a depriving or abusive situation. In adulthood, they are inaccurate, dysfunctional, and limiting. Generally, they are strongly held in the person's mind, but outside of awareness. In clinical work, 18 specific schemas are distinguished. We will have some detailed videos on them. In schema therapy, the goal of the treatment is to engage in schema healing processes. These processes are intended to weaken the early maladaptive schemas and coping styles as much as possible. They also focus on building up the client's healthy part. From the beginning, an alliance is formed between the therapist and the healthy part of the client against the schemas. The first step in therapy is to do a comprehensive assessment of the client. The main goal of this assessment is to identify the schemas and coping styles that are most important in the client's psychological makeup. There are several steps to this process. The therapist generally will first want to know about recent events or circumstances in the client's lives which have led them to come for help. The therapist will then discuss the client's life history and look for patterns which may be related to schemas. There are several other steps the therapist will take in assessing schemas. We can use the Young Schema questionnaire, which the client fills out, listing many of the thoughts, feelings, and behaviors related to the different schemas. There are also various imagery techniques which the therapist can use to assess the schema patterns. One specific technique involves asking clients to close their eyes and create an image of themselves as children with their parents. Often, the images that appear will lead to the core schemas. During the assessment phase of treatment, patients are also educated about schema therapy. The therapeutic relationship plays a very important role in this form of treatment. It is conceptualized as limited reparenting, which means that the therapist takes on the role of a parent and displays warmth and caring behavior toward the patient within the limits of the therapeutic situation, of course. The style of this reparenting relationship should be adapted to the patient's individual problems or needs. Particularly for patients with personality disorders, the therapeutic relationship is regarded as the place in which the patient is allowed to and dares to open up and show painful feelings, try out new social behaviors, and change interpersonal patterns for the first time. Thus, the therapeutic relationship is explicitly regarded as a place for patients to work on their problems. There are many techniques that the therapist can use to help clients weaken their schemas. These techniques can be broken down into four categories: emotive, interpersonal, cognitive, and behavioral. Emotive techniques encourage clients to experience and express the emotional aspects of their problem. One way this is done is by having clients close their eyes and imagine they are having a conversation with the person to whom the emotion is directed. They are then encouraged to express the emotions as completely as possible in the imaginary dialogue. Several other powerful corrective imagery techniques are used as well. Chair work involves the patient moving between two chairs as he or she dialogues between different parts of himself or herself, such as a schema side and the healthy side. Dialogues can also take place between the patient and imagined significant others for such purposes as reaching closure or practicing assertiveness. Interpersonal techniques highlight the client's interactions with other people so that the role of the schemas can be exposed. One way is by focusing on the relationship with the therapist and relate present communicational and emotional patterns to everyday functioning and past events in the client's life. Cognitive techniques are those in which the schema-driven cognitive distortions are challenged. Dysfunctional thoughts are identified and the evidence for and against them is considered. Then, new thoughts and beliefs are substituted. These techniques help the client see alternative ways to view situations. The first step in dealing with schemas cognitively is to examine the evidence for and against the specific schema which is being examined. This involves looking at the client's life and experiences and considering all the evidence which appears to support or refute the schema. The evidence is then examined critically to see if it does in fact provide support for the schema. Behavioral techniques are those in which the therapist assists the client in changing long-term behavior patterns so that healthy coping responses are strengthened and schema-directed behaviors are decreased. Homeworks are widely used in the schema therapy approach as well. For example, flashcards are written statements referred to by the patient in between sessions. They are usually a co-creation of therapist and patient and are statements used to strengthen the healthy functioning in the client between the sessions. The messages and sentiments expressed in the cards are gradually learned and internalized, but they also serve as links to the therapist between the sessions. If you became interested in schema therapy, you can contact me at my email address. Check out my webpage for more information and regular self-development activity updates.